All right, what is enteral and parenteral nutrition? Let's start with enteral. Enteral nutrition is a way of providing nutrition to those that are unable to eat, and those are mainly patients who have some sort of condition that impairs their ability to swallow. And those conditions can include stroke, Parkinson's, amyotrophic lateral sclerosis, and there's many more. Also, being on a ventilator or having some sort of altered mental status can be a reason for needing enteral nutrition. Enteral nutrition is given through the GI tract, so all the organs involved there would need full functionality. And also, enteral nutrition is mostly given through a tube that will go through your nose or your mouth. There's also a tube that goes directly into the stomach, but it's mostly through the mouth and nose. And that tube would either empty into the stomach or straight into the small intestine. So on the other hand, let's look at parenteral nutrition. Parenteral nutrition is a way of providing nutrition to the body as well, but it's through the veins or intravenously. And that can be either given through a central line, and that would be called central parenteral nutrition, or through a peripheral IV, and that would be called peripheral parenteral nutrition. And those are mainly for patients that need immediate calories or for patients that have severe GI diseases. There's two types of parenteral nutrition. First would be partial parenteral nutrition, and that would mainly be used to supplement other types of feeding. It's mainly for those that have some sort of calorie deficit or for those that are malnourished. The second type would be total parenteral nutrition, and that would mean that all of that patient's nutrients would be given through that line. And those are mainly for people whose digestive systems don't work at all, or they have some severe GI disease. Now that we know what enteral and parenteral nutrition is and what their differences are, let's discuss their advantages and disadvantages. So again, we'll start with enteral. Enteral nutrition has some good advantages. It's cheaper than parenteral nutrition. It's simple, and it's more simple because it uses more natural processes. It only bypasses like your mouth and your esophagus, and the rest of your GI tract, it's digests normally. There's also a less risk of an infection thanks to your GI tract's mucosa, and also it stimulates intestinal blood flow. The last advantage would be that it has a lower risk of hyperglycemia and electrolyte imbalances. Now, there are some disadvantages of enteral nutrition. There is the risk factor of aspiration, and you just need to make sure that either your tube placement is correct and it's in the stomach, and there's also possibility of agitation of this tube insertion around the mouth or in your nose. It can also agitate your stomach and your throat. Enteral nutrition can also cause diarrhea, and the last disadvantage is that it's not as fast as parenteral nutrition. Now, speaking of parenteral nutrition, it does have some pretty good advantages. It has a basically immediate effect. So if a patient needs some immediate calories, that is the way to go. It does not rely on GI function, so it's straight to the bloodstream, and that's what makes it pretty much immediate. It's a relatively safe procedure, and the nutrients that are administered can easily be customizable to fit the patient's needs. Now, there are some disadvantages of parenteral nutrition. There is a much higher risk of infection, especially with central line administration. There are increased risks of an infection there. It is also more expensive because parenteral nutrition requires more resources and, for example, extra monitoring. There's also an increased risk of hyperglycemia and electrolyte imbalance. And speaking of hyperglycemia and electrolyte imbalance, some patients that take parenteral nutrition can get hypoglycemia or low blood sugar. And that can be caused due to either abrupt discontinuation of parenteral nutrition or inadequate glucose infusion through that solution. It can also be caused by some sort of infection or other metabolic disorder that can come through parenteral nutrition. As a nurse, we have to be aware and constantly check blood glucose, especially when starting or discontinuing total parenteral nutrition. We also have to make sure that TPN is gradually discontinued. Make sure that that prescription is tapered so that they don't get like a flash of no nutrition at all. We should also monitor for signs of hypoglycemia that would show confusion, diaphoresis, or shakiness. Another problem associated with TPN is hyperkalemia, or high levels of serum potassium. And high levels of serum potassium can be bad because it can lead to serious cardiovascular and neuromuscular complications. And that can mainly be caused by some sort of renal impairment or kidney dysfunction that cannot excrete potassium properly. It can also be caused by certain medications like potassium-sparing diuretics or ACE inhibitors. As a nurse, we should always stay vigilant with that. We should always assess for ECG changes, and that can include peaked T waves, widened QRS segments, or bradycardia. We should also monitor blood work to make sure potassium levels aren't high, and also recommend and think about renal function tests to ensure proper excretion. When giving TPN, a nurse has many things to do. TPN is a prescription, so we should treat it like so. We need to confirm with the patient with at least 2 identifying factors. Also, check and compare the prescription with the chart multiple times. Next, we would prepare the necessary supplies. Total parenteral nutrition requires a septic technique to lower the risk of a central line-related infection, or CLABSI. Make sure you have the proper filtered line, and make sure to inspect the solution for any abnormalities like discoloration or particulates. And start the infusion slow and gradually increase it. Make sure to monitor the blood glucose and for any signs of infection, electrolyte imbalance, or fluid volume overload. And most hospital policies require that total parenteral nutrition lines are replaced every 24 hours. So when it comes to teaching a patient on total parenteral nutrition, you would have to explain to them why they need it. Do they have some sort of GI complication, or are they off a surgery where they would need it? Tell them things that they will expect, and that can include frequent weight checks, blood glucose checks, electrolyte level blood tests, and about how long you think that infusion would last. Also, teach them about the possible side effects, and that could be hyperglycemia, and teach them the side effects of that, thirst or fatigue, and also teach them how to self-test their blood glucose if they can. Also teach them the side effects of hypoglycemia. Know that the side effects could be dizziness or sweating. Also teach them the signs of infection or signs of electrolyte imbalance. Also, with education, you would need to educate their caregiver, as that's who they're going to be around a lot, or some patients can actually receive total parenteral nutrition at home. Make sure that caregiver knows to follow the provider's instructions, especially the dosage and times of administration. And that caregiver also knows the signs and symptoms that I just talked about earlier. And also help them to know that they should take the patient to the hospital if any of those side effects are seen. They should know to practice aseptic technique, wash your hands before handling the solution and any of the supplies, and avoid touching the catheter site to reduce that risk of infection. Also, store the total parenteral nutrition solution in the fridge, and then come time to administration, let it warm up to room temperature for about an hour or 2. But you never want to microwave that solution. Always check that bag of solution before administration. Check it for that expiration date, for any leaks, and any abnormal colors or precipitates. But yeah, that's all. I hope you guys learn more about enteral and parenteral nutrition.